Now, if you have an infection of the skin due to eczema and your barrier of your skin is exposed, you should ideally try to avoid using steroids. Now, this is a catch-22 because you want to control the flare-ups, but you're advised not to use the steroids, and this is because the steroids can actually make the infection worse. So in some cases, your doctor will tell you to stop using steroids temporarily while you're given antibiotics cream or oral antibiotics, depending on the severity and spread of the infection, to control the infection. Once the infection is more controlled and the barrier of the skin is not as exposed, then you can start using steroid creams. There are occasions where you need a combination of both your steroid and antibiotic cream. So there are preparations such as Fusobet, Trimovate, Timodine that contain preparations of antibacterial, antifungal, steroid, and other ingredients that would help to control the infection while reducing the inflammation, which is especially useful in more localized infections than widespread infections. Now, going back to severe eczema, if you find that your betnovates, your Elocons, and your Demovates are not working, then this is the point where your GP really should be referring you to a specialist. But you also want to think about the possible triggers, because there are triggers that might be causing your eczema to be ongoing or prolonged. So could you be allergic to house dust mites, which are little mites that you cannot see with your naked eyes? They're usually found in your carpets, your mattresses, your pillows, and ideally you should change your beddings, your carpets every 3 years to prevent house dust mite, because you could hoover as much as you want, but you cannot get rid of these house dust mites. You also want to think about certain types of foods such as nuts, dairy products, cheese, yogurts, milk that can cause flare-up of your eczema, pets dander like furs from cats and dogs, even your clothes such as cotton, other allergies such as pollen, certain types of trees, changing the weather. This can all potentiate your eczema and cause frequent flare-ups and make it to get worse. And don't forget stress. Stress can also be a trigger factor for eczema as well. So therefore, other treatments will include trying to avoid the triggers as much as possible, changing your diet, speaking to a dietitian who can give you a dietary plan that helps to control flare-ups of eczema if you notice that your eczema is due to diet. There are other treatments such as phototherapy, where you're being exposed to UV light. There is oral immunosuppressant medication such as oral steroids, which ideally should be used on a short-term basis, because oral steroids have more severe side effects, such as they can cause moon face, weight gain. There's risk of osteoporosis. Even steroids can affect your mood and cause mood swings. Then you have other immunosuppressants, which are normally used for conditions such as psoriasis, rheumatoid arthritis, such as your methotrexate, your ciclosporins. These all have side effects. They can cause lung problems, they can cause liver problems, they can cause problems with your bloods, and they really dampen your immune system, which makes you more prone to infections. And then you've got what you call your biologic, which is like your human monoclonal antibodies. I cannot pronounce the names, but think of your inflamamab, your dumabs, they all end in MAB, which is your MABs. And these are very effective for controlling flare-ups of eczema, but they're also very expensive. So usually they're given when nothing else has worked. Now, I hope you enjoyed this video. Please feel free to check out my video on using steroids to control flare-ups of eczema. And if you have any questions, please feel free to drop comments below.